So by now, you've heard of Ozempic, you've heard of Wegovy, you've heard of Mounjaro even, and Rick Ross being on it. I don't know. But what are these drugs and why are they so popular and what do they do? Let's talk about it. So Ozempic and Wegovy are part of a drug family we call semaglutide. They have been indicated for the treatment of diabetes, but they've also found a place in people's weight loss journeys. As a weight loss drug, they are indicated for patients who have a BMI of 30 or greater, or who have a BMI of 27 or greater with obesity-associated complications. What does that last part mean? So obesity-associated complications are things like osteoarthritis, diabetes, hypertension. When you compare that to the requirements for bariatric surgery, which are that you need to have a BMI of 40 or greater, or 35 with obesity-associated complications, you realize that the threshold to begin medication or weight loss medication is a lot lower than that for surgery, which makes sense. They work by stimulating insulin release, which is why they have been primarily drugs to treat diabetes, delaying stomach emptying. Again, this is a drug class that was originally used and described and indicated for the use of diabetic treatment. So, for a lot of these drugs, when we're using it for weight loss, it's an off-label usage. What that means is that the FDA has only approved it for the treatment of diabetes. However, we've also found that it's been effective for weight loss, and so that is, again, off-label. There are only 2 drugs in this drug class currently that are FDA approved for the treatment of obesity, and those are Wegovy and Saxenda. To date, they are the most effective drug that we have for weight loss treatment. And if you look at them side by side with bariatric surgery for weight loss, we find that the average or mean weight loss in patients has been 15 to 25% of their weight. Compare that to bariatric surgery where the average or mean weight loss is about 25 to 35%. Are there side effects? Yes, and that's true of anything that we do in medicine. There are always risks, right? So the risks or the side effects, potential side effects for these drugs are things like nausea, vomiting, constipation, diarrhea, abdominal pain, headache. However, by and large, these are well-tolerated drugs and people seem to have minimal problems with them. It's been shown that only less than 10% of patients report that they just can't tolerate the medication because of the side effects. However, 90% are doing well with them without any significant issues. And the big question is, if you stop the medication, does the weight come back? This is where I stop and say that any method that we use for weight loss, meaning bariatric surgery or medication, should really be combined with a total lifestyle change, right? Change in diet, change in activity to encourage increased mobility, increased exercise. With that said, a recent study looked at patients 1 year after the drug had been stopped, and it found that on average, patients regained 2/3 of their weight back. If we again make the comparison with bariatric surgery, when you look at the gastric sleeve, there's about a 28% weight regain. With the gastric bypass, the weight regain is at about 4%. What does that mean for the long term? So long term, it means that surgery is still the more permanent solution. And that if we want to maintain a steady weight with these drugs, we really need to consider them long-term drugs. That means that unless you remain on the medication, that the long-term results will be that you will most likely, unfortunately, regain the weight. That being said, remember that lifestyle changes always work. Changing diet, increasing exercise, always work, and they help to maintain the results no matter how you choose to lose the weight in the first place, whether it be by surgery or medication. So what does this mean for plastic surgery and semaglutide use for weight loss? In the immediate setting, remember that part of the way that these drugs work are by delaying gastric emptying or stomach emptying. And also keep in mind that for surgery, to minimize your risks of aspirating food contents into your lungs and having a massive lung infection, you really want to have an empty stomach. This is why we tell you to not eat or drink after midnight the day before. And so the new recommendation is that this drug be delayed for a few days before surgery to minimize that risk. Long term, while the jury is mostly still out, I think what will hold true are the tenets that we've always had for massive weight loss patients, which are that we want your weight to be stable 3 to 6 months at least before we begin body contouring. And we really want you to maintain that weight stability after so that your result is as durable as possible. And so long term, what we may be seeing is that people just remain on this medication, and at some point it's just to maintain the weight loss. And if you plan to discontinue the medication, then you really need to have a conversation with your primary physician and your plastic surgeon to figure out if that's really the best move for you and if that will achieve what you want to achieve. But what are your thoughts? Leave your comments and questions below. As always, love you lots, and bye for now.